Good morning, students. We will see the remaining the questions answers in the OBG nursing. In pregnancy, the muscle fibers of uterus is in size due to the process of In pregnancy, the muscle fibers of uterus increase in size, not in size, increase in size due to the process of hypertrophy and hyperplasia. In a normal pregnancy with a normal BMI, the weight gain should be between 11 to 13 kg. The weight gain during first, second, and third trimester is respectively 1 kg, 5 kg, and 5 kg. The amount of water retained during pregnancy at term is 6.5 liter. The blood volume is increased to 5500 ml at term. The normal albumin globulin ratio is 1.7 is to 1, but it changes to dash during pregnancy. That means 1 is to 1. The cardiac output is lowest in sitting and supine position. The cardiac output is highest in lateral position and knee chest position. The total iron requirement during pregnancy is approximately 1000 gram. During the late pregnancy, the gravid uterus makes a compressive effect on inferior vena cava when the patient is in supine position, which will result in hypotension, tachycardia, and syncope, and it is known as supine hypotension syndrome or postural hypotension. The commonest cause of amenorrhea is pregnancy. The bluish discoloration of vagina is called as Chadwick sign or Jacquemus sign. There is increased pulsation felt at lateral fornices of vagina from 8th week of pregnancy is called as Osiander sign. The softening of the cervix from the 6th week, that is cervical sign, is now called as Goodell sign. Upper part of the uterus is enlarged, the lower part is empty, soft, the cervix is firm, the sign is known as Hegar sign. Hegar sign is usually demonstrated between 6 to 10 weeks. There is a asymmetrical enlargement of uterus if the lateral implantation, that is called as a Pisces sign. The regular rhythmic contraction felt during 4th to 8th week is called as Palmer's sign. The first trimester is ranges from 1 to 12th week. The perception of active fetal movement by the mother for the first time is called as quickening. Quickening is felt at dash week for a prime, 18th week for a primate. Quickening is felt at 16th week for a multiparous woman. The second trimester is lasts from 13th to 27th week. Nagel's formula is LMP plus 9 months plus 7 days. As per WHO, the recommendation of a pregnant lady should visit antenatal clinic at least 4 times. The first visit should be at 16th week, the second visit between 24 and 28 weeks, the third visit should be at 32 weeks, and fourth visit at 36th week. Kilocaloric requirement during non-pregnant state is 2200 kilocalorie, which will be increased to 2500 kilocalorie during pregnancy. The protein requirement should increase to 50 gram to 60 gram during pregnancy. The calcium intake should be increased from 500 milligram to 1000 gram during pregnancy. Which vaccines are contraindicated in pregnant lady? Rubella, measles, mumps, and yellow fever, because these are the live vaccines. Which vaccines can be given for a pregnant lady? Hepatitis A and B, tetanus toxoid. The injection tetanus toxoid first dose is given between 16 to 24th week. When a couple seen and counseled about pregnancy, its course outcome well before the time of actual conception is called as preconceptual counseling. A needle inserted through the maternal abdominal wall under ultrasound guidance and puncture the umbilical vein, and 0.5 to 2 ml of blood is collected under local anesthesia. It is called as chordosynthesis or percutaneous umbilical blood sampling. Chordosynthesis is performed usually after 18th week of gestation. The relationship between long axis of the uterus to the long axis of the fetus is termed as line. When more than one part of fetus is presenting, it is called as compound presentation. Part of fetus occupying in the lower pole of uterus is termed as presentation. 1 liter of milk containing 1 gram of calcium. The relationship between denominator of presentation and 6 point on the pelvic brim is known as position. When the widest presenting transverse diameter has passed through the pelvic brim, it is called as engagement. The relationship of the fetal head and its limbs to the trunk is called as attitude. The phenomena of the uterus uterus in labor, in which the muscle fibers are permanently shortened, is called as retraction. The woman who is in labor is called as puncture. The woman who is pregnant for the first time is known as primigravida. Thank you for listening. If you have any comments, please let